To have society where the people from walk of life, irrespective of social and economic, ethnic and cultural status, can enjoy a healthier, longer and happier life. And our mission to create awareness about heart and heart diseases and promote healthy lifestyle at every stages of life through health awareness program, workshops, health camps, academic and other activities. This association first established in 1999 and our founder president was Dr.Nirmal Bhattacharjee, and he is still holding the position of president, and with his enthusiasm, dedication, we organized many programs across Northeast. We have already organized 200 health awareness programs across the Northeast and more than 50 health camps where free medication and medicines are given to the people, common people. At present, we are working with the 4 chapters, one in Guwahati, one in Tinshukia, Silchar and Nagaon. And we specially organize 3 programs in a year. One is World Heart Day in the month of September, Women's Heart Month in the month of February, where we organized many programs in the month of February in every corners of Assam and other parts of Northeast. Lastly, this time is less. I like to conclude my words with a small poem of William Wordsworth.
So it will be an introduction to the heart care only, not a detailed elaborate, which requires about a 1 day program. And the main idea, and everyone is very concerned about that one, is how you have to prevent, how you have to survive, and how to live after a heart attack. That is the most important problem that we are facing nowadays. We are also hearing about that one. And today to this young generation, I want to convey that message that preventing a heart attack, surviving the heart attack and living after heart attack is possible, provided we take care in time. So before we start talking about that one, let's look at this beautiful organ. But I think I won't be able to play that one because this one is put in the pen drive. Okay, it is coming. I hope it is coming. Sorry, it will come. I put in the pen drive only. So anyway, this heart, you have heard about it, but you don't know about it. We take it for granted. The heart is there, heart is beating. Now, why you are putting this program on the heart care? If you know, and if you also, I think you also know about that one, that heart is a silent workhorse. You don't have to think about heart is working. Whether you think about it or not, will be working. It is working, as mentioned, from the womb to tomb. Now, this organ, it starts beating at the 4th week, within 1 month of conception. Before the mother knows that she is pregnant, the heart starts beating inside the mother's womb. Until you breathe your last, it goes on beating. Now, it doesn't take any rest. You know, everywhere, it doesn't take any rest. Even if you are sleeping, it is also working. And it is first to stop, first to start beating, and last to stop working. So you see how much faithful, vital this organ is. It is made to last a lifetime. A lifetime for us, we can always say that we live 60 to 70 years, but human beings are supposed to live up to 100 years. Our biological lifespan is 100 years. Who don't live it, that's a bad issue, but we're supposed to live 100 years. Unfortunately, the heart, it gets diseased and fail to function, and it leads to the disability and the death. Cardiovascular disease is the #1 killer of our times. Earlier used to have many infections killing us. You have heard about the cholera, you have heard about the plague, you have heard of malaria, tuberculosis, AIDS and all those things. But these are gradually getting controlled eradicated. What we are coming is what is called the lifestyle disease, and cardiovascular disease is the number one killer of our times. Just give it a statistics, 10% of the urban population, you take 100 people in the urban population, 10 people will be having the cardiovascular problem. In that village surrounding, 4 persons out of 100 will be there. Every minute, 4 persons is dying of the cardiovascular diseases. And important point is, one of them, out of the 4 persons, one will be below 40 years of age. That means people like you, younger people, they are having the problem of the heart disease. And most important, the 30% of the death, 1/3 of all the deaths are sudden. No warning, nothing of the sort. You can't take that I will get no warning, I'll take precaution. It's not like that. It is suddenly happening before anyone can take any measure or go to the hospital or take any treatment, and the deaths happen. So it's essential to take care of the heart. But they always we think about that we must take care of the heart, but question is how. There are two things are there, there are two aspects of it. In one aspect is you must know your heart. You cannot take any action. You cannot take blindly, you cannot follow anything because it's lifetime care. So you must know about your heart and know the diseases that happens and that affects the heart. And then secondly, you must know what to do and how to do. So these are 4 things you must be knowing very well so they can take care of your heart. And as I mentioned, I cannot give everything about those things, but I just give you some idea about the heart disease and what to do and how to do. In matter of the heart, we talk, especially the young people, how do you think about the heart? Can you give us an idea what you think? When you tell about the heart, what comes to your mind first? What comes to your mind? Anyone? Let us be interactive. What comes to your mind? You think pump. Oh no, you are very unromantic man. When you say about the heart, especially, we always think of the emotional heart. Always think, he's a good-hearted man, she's a good-hearted man, she's a lovely hearted lady. Something like that, no? Big-hearted, small-hearted. These are things we always say about the emotional heart. We're concerned about the romantic heart, emotional heart. These songs, the drama, the literature, everything we talk about is about the emotional heart. But as she is telling, we must go beyond the emotional heart also and think about our physical heart. Thank you very much that you put it in that physical heart. And in the physical heart, the heart will be nothing but a, just see how unromantic that picture is. The beautiful heart I showed you, I could not show that picture, but you see I put it in that engine, a pump. It is basically a pump. Forget about the emotional part of it, romantic part of it. It is a pump, and in pump it has got so many things. In the engine you get the valves, the muscles, the piston, the battery, and all those things. The fluid lines, the fuel lines, everything. So also in the heart we have got this other structure. I know, I'm sure you know it very well. The chambers and all those things. Now, in heart acts as a pump. Yes, it is acting as a pump. Now, when you say about the pump, there are 2 parts of it. One is the mechanical part. Just take an example of car engine. In the car engine, we will have a mechanical part, the pistons and the valves. So here also we got the pump, will be muscles, the valves, the pipes, and other in the electrical system. In the car you have got the battery. Same thing in the heart also, you get a small battery like a rice seed. Just imagine. All the energy for the heart is originating from that small rice seed-like structure in the battery of the heart, natural pacemaker, which is situated in the upper right, in the chamber of the heart. So we got the 2 parts, one is mechanical part, one is the electrical part. I am just dissecting the heart now. So those 2 things, mechanical and electrical, they work efficiently in a coordinated manner to give you a pumping organ, which pumps 5 liters of blood per minute, but if you require it, it will go up to 30 liters. You don't have to do anything. Automatically adjust and it goes to the 30 liters, maybe more than that. So it maintains the cardiac output for this function. The two important systems in the heart. One system is, we call them the coronary system. The coronary system, where this heart gets its own blood supply. Heart pumps the blood, but they also get its own blood supply. These are something like the pumps that you can see. These arteries, no? Okay, just a minute. You got the pointer? The block, so that is your, we call it the fuel line. And the other one is your electrical system mentioned. Then you can see the current is coming from this part. So this is your battery system. This is called the electrical line, the power lines. The fuel lines and the power lines, these are the two things which keeps the heart working. So how the heart gets affected? The pump, they can be a fuel line block or power line block. Remember these two things. You know, 80% of the heart disease. The fuel lines are blocked, arteries are blocked, or the power lines are blocked. So if the fuel lines are blocked, we get it what we call the heart attack. We have heard about the heart attack. And if the power lines are blocked, we get a heart block. So heart attack and heart block are the two things. Now, sometimes the valves and the muscles, they also get affected. We get a condition which is called the heart failure. So the three terms are there: heart attack, heart failure, and heart block. Heart attack can give rise to heart failure when the heart fails to pump. The heart block can also give rise to heart failure. So heart failure can take at any stage, it can have that heart failure. But most sinister, dangerous one is called the cardiac arrest. When the heart stops beating. You must have heard about Sri Devi. She mentioned that she died of sudden cardiac arrest, sudden cardiac death. Reasons for it is different, but what is happening that heart stopped. So this is called the cardiac arrest, sudden cardiac death. And this is the most sinister of all. You never know the reasons, rhyme and reasons. It can be because of fuel line block, it can be because of the power line block, electrical disturbance. What is happening? The heart stops functioning. What are types of heart disease? This also must know. There is number of diseases, but for you, because you can know how to take precautions, so you can know that one. The types of heart diseases are: first is you can born with the abnormal heart, and that is we call them is the congenital heart disease. You heard about the formation of the heart is defective, the holes in the heart, the blue babies, all those conditions are the inborn error in formation of the, or when the heart is forming in the mother's womb. We can have a congenital heart disease. Next, this is in the babies. Next comes in the children. In the children, the rheumatic heart disease. Very, very common, especially in the, the social, the economically backward population, socio-economic population, that one, overcrowding, all those things. And it starts with a small, very simple throat infection. You get throat infection, if everyone suffers from throat infection, then for throat infection it can become the rheumatic arthritis, the joints are involved, then the heart valves are involved. And prevention is very simple. When someone is having a throat infection, if you go to a doctor and take an antibiotic to take the infection, then this rheumatic fever won't be there and you won't have a problem with the valves. Because valve problems later becomes a condition for the heart failure. Somebody replace the valves, repair the valves, all those conditions are there. So rheumatic fever also can be prevented, and it's very simple steps. Third is here, basically the coronary. So congenital heart disease, rheumatic heart disease, then the coronary artery disease. Then comes the electrical disturbance, arrhythmias. Heart rate, rhythm becomes irregular, slow, fast, suddenly it stops. These are called the arrhythmic heart disease. And most of the cases, sudden cardiac death is because of the electrical disturbance, not because of any blocks in the coronary artery. It can happen to young people. There are many reasons for that one. You must have heard about, these sometimes marathon runners. They suddenly collapse and die. In the football field, sports person, they suddenly collapse and die. Then because of this electrical disturbance, the arrhythmic heart disease. And lastly, this is called the cardiomyopathy, when the heart muscles are weak. Everything is okay, but muscles are weak. So you can have a cardiomyopathy. So these are the 5 main groups of diseases that can affect the heart, and all of them are preventable. You don't have to get the disease, you can prevent them. Of all the diseases, this is the cardiovascular disease, is the coronary artery disease is the most important condition. It is a silent epidemic of the 21st century. We can say that we are facing the epidemic, and it is silent epidemic of the 21st century, and it is a malady of the millennia. We call the malady of the millennia. And I am very, we are very much concerned about why we are coming to you. Because nowadays we are seeing the younger people are getting the problem of coronary artery disease. Even at 22 years, 24 years. Now many of you who have started your career, you have not yet gone to beyond your educational level, educational stage. When you starting your career, you go up in the career. When you are reaching the peak of the career, something happens to you. You get a hypertension, diabetes, coronary artery disease, and all the efforts that you have, all the money, time, and effort you have spent to go to that level of career, it gets, spoiled. That is the reason why I have come to you and to talk to you about how we can prevent this malady of the millennia. When you say the cardiovascular disease, we will talk about the heart, and heart. Please remember, it is not only the heart. Because same thing is happening in the brain also. And the condition of stroke, the brain attack, is also the same thing. In fact, these are the twins. The twin diseases. Heart attack and the brain attack or the stroke are the twin diseases. They are the same pathology. Pathology is the same. Once happens in the heart, is the heart attack. Happens in the brain attack. The blood cell is affected, so you get the same pathology, same risk factor, and both are preventable. So we're talking about the heart, we're talking about the brain also, and you're taking care of your heart, you're taking care of your brain, taking care of your kidneys, care of other organs. That's why you mentioned the care for heart is care for life. Heart attack is the stroke, heart attack is the MI or myocardial infarction. When there is a block in the artery, then blood cell is affected, heart muscle dies. This is called the myocardial infarction, and this is the death of a muscle of the part of the heart, and then we got the brain, you get the brain attack or the stroke. So normal blood flow, and the flow is blocked by the blood clot, then you get the cerebral arteries are blocked, the brain is damaged, you get a stroke. Now coronary artery disease is a block. What is block? Happens because of plaque. Plaque is something growing inside the artery and obstructing the flow of the blood. Now this can happen in the coronary artery, the cerebral arteries. Now in the coronary arteries, when the block is there, the arteries get blocked by the plaque. Plaque is because of fatty materials, cholesterol, other things that deposit inside the coronary arteries. You get a block, and you can have an acute problem. Acute problem is the heart attack. Everyone knows about it. It is a dramatic problem. Suddenly someone gets a heart attack, chest pain, and all the complications are there. You can make a diagnosis and you rush to the hospital for the treatment. But apart from the acute condition, you can have something like a chronic. Brain function goes away. Normally after 50, 60 years, you see the brain function, the memory loss, this loss, that loss, function, the higher functions gone away, and we think that he is getting old. That's why his brain is not functioning. But not getting old is not the cause for this brain function of dementia, what we call. It is because of the blood supply is affected. It is a condition called as vascular dementia. So blood vessel affected in the old age or even middle age because of the blocks can give rise to a dementia. This is the vascular dementia. You can have Alzheimer. Alzheimer is something different. But vascular dementia, it's better to make a diagnosis of vascular dementia because it is treatable. You can treat. Alzheimer's is not treatable. You can just delay the process. But vascular dementia, you can treat. So, what is our objectives for heart care? Objectives for heart care are you prevent a heart attack, you survive a heart attack, you live after a heart attack. Now, this is not isolated. It's not that I will prevent, I will survive, I will live. All are a holistic concept, totally. You must make it a part of a comprehensive strategy for a better, longer and healthier life. It is a holistic approach to heart care. Holistic heart care means it take care of physical heart and also emotional heart. Emotional heart is also important. Emotion plays a very great role in causing the heart diseases. So it is emotional heart is also important, and then heart care totality you call it the holistic heart care. So this is my first part, introduction subject. Now we'll come to the how the cardiovascular disease develops. You know about the heart now, so let's see how cardiovascular disease develops. This is a disease of the blood vessel. We say about the heart disease. Remember, this heart disease is nothing but disease of the blood vessel. It is a question of supply, blood supply. So wherever there is a blood vessel, it may get blocked. In the heart, it is a heart attack I mentioned. In the brain, it can be brain attack. In the kidney failure, you can have a blocks in the artery, in the limbs. So these are the different areas you can have a problem with the heart disease. You can see yellow thing depositing. This is called the fatty streaks. Then gradually it becomes more and more. You can see that's obstructing the lumen, and then you get suddenly it burst. You get a clot. So these are the 4 stages of the coronary artery disease. The plaque forming, normal artery, fatty streak, fibrous plaque, and rupture with a clot formation, and you get a heart attack. Now, how this plaque is formed? We know that plaque is forming. Plaque is forming means that blocks are forming, something obstructing the flow of the blood. But how it is forming? We always say about the cholesterol. People are concerned about the cholesterol. They say the lipids are high, my cholesterol is high, so I'm getting the problem. No, it is not only the cholesterol. 2 things are there. One is, of course, the blood lipid, the cholesterol level in the blood. If it is very high, it will get deposited. Other thing is your lining of the arterial wall. If the lining is good, normally the lining keeps itself clean by mechanism. The lining of the cells, they clean up themselves. But if the cells are damaged, the lining is damaged, then only cholesterol get deposited. So you can get the problems only when you got the interaction between the two, the lining of the blood vessel and the blood lipids. So that's why in many cases, even if cholesterol is normal, lipids are normal, you can have a block because the linings are damaged. So with the normal cholesterol also you can have a block. And there comes why the lining gets damaged. Many reasons. One of them may be inflammation. We say that it is a disease of the artery, but there is inflammation takes place, and so there is a deposit of the clots. And inflammation can take place, damage to the endothelial lining. One of the important cause for the inflammation is smoking. If you smoke, the nicotine will cause a lining damage, and that will cause the lipids to get deposited and making a plaque. That is the relation between the smoke, nicotine, and the plaque formation. So if there is a plaque is forming, when there is a normal artery, there is no block, you can see this so smoothly it is flowing, there is no symptom. Then if partially it is blocked, you get chest pain, angina. Angina means when you are moving, walking, in exertion you get a certain chest discomfort, this is called the angina. And then when there is certain complete block, because the clot forming, you get heart attack. So heart attack occurs not because of only the blockage of plaque, by the plaque. It is a plaque plus suddenly burst, and then clot is formed. So you get a heart attack. So it happens so suddenly because of the clot formation. So it is rupture in the thrombosis. So how the coronary artery gets blocked, I mentioned, the blockage of the coronary artery occurs because of, one is the plaque which is forming, one is the clot which is forming, and the third one is also important. Sometimes without plaque, without clot, the artery block can be blocked, and that is what is reason is the coronary spasm. And the coronary spasm means the artery suddenly becomes very narrow. It goes to spasm. That happens especially in smokers. In smokers, the artery becomes very hyperreactive. So you can have a very suddenly you get constricted because of certain emotional strain or something, even after this in a rage, anger, or an emotional state, it can get into coronary spasm. And it can happen, and this happens mostly in the women. This spasm occurs mostly in the women. You don't get anything in the big artery, but small arteries get spasm and you get the problems of the heart diseases. So, in prevention of the heart attack, what will be our strategy? Once you have understood up to this much, you know that our strategy for prevention will be three things. One strategy will be you prevent the plaque. Don't allow the plaque to form. Second, you prevent the clot. Don't allow the plaque to burst and make a clot inside the artery. And third is you prevent the spasm. So these are the three the strategy that you can adopt. This is the important slide in the sense that this will give us a picture of a natural course of the coronary artery disease. We always think of the coronary artery heart attack that is happening now. If someone gets the problem, we always think it is happening now. It is because yesterday something has happened, so today I am having a heart attack. But the natural course of the coronary artery disease tells us that it is a long-run process. Now, everyone has got a beautiful, colorful life. We have life is a beautiful spectrum of the colors that you see. The two ends are fixed. You can't do anything about it. One is your birth, one is your death. In between the journey of a colorful life, it is marked by many events. So many events are there in our life. Everyone think about it. So once you grow up, we are acquiring the risk factors for the heart disease. Then you get the process starts in the coronary artery, atherosclerosis. That is the medical term, atherosclerosis. Then you get the symptoms of angina. Then you get a heart attack, heart failure, and the anesthesia comes. So in the subcontinent, everything gets squeezed. It is telescoped. So all the stages are telescoped. For both the ends, it is being compressed. And so in a short period of time, we can have all the stages. Stage 1, stage 2, stage 3, stage 4. It can start as 15 years of age, and 25 years of age you get a problem with a complicated stage. The reasons I cannot explain in a short period of time. There are so many reasons for us in the Indian subcontinent that we are suffering from this high incidence of coronary artery disease because of this process of the squeezing of the stages. So this is the accelerated course for us, for the Indians. So action for prevention, we must take action for prevention at every stage the cardiovascular change. So what is the action will be there? I mentioned about this awareness, action and prevention. The action for prevention is, first is, you don't have to do anything. Just don't allow the risk factors to come into your life. Don't allow the risk factors. Second, even if someone is having the risk factor, then you prevent the disease. You can do it. Third, you can prevent the heart attack. Fourth, you can prevent the progression of the heart attack, progression of the disease, to the heart failure, and you can prevent the avoidable death. I'm not telling you that you prevent death. It is impossible. Everyone have to die. But the untimely premature death can be prevented. We call it that avoidable death. Avoidable death can be prevented. The different levels according to that one. Just like you start your education, you go to primary level, secondary, then you go to graduation, post-graduation, different levels. The same also, action prevention can be primary level, or it can be secondary level, it can be tertiary level, or the higher level. So the different levels, but the principles are remain the same. At what level you start, the principles will remain the same. Whether you are graduating in the prevention or you are doing primary level prevention, the principles remain the same. It is only the degree of the prevention or the measure that you take will vary. We have heard about or we have learned about the natural course of the disease, but natural course we are not seeing. We can't see what's happening inside unless do some test investigations. But clinical course is also important. That will give us an idea how clinically you will know that at what stage we are going through. So first is clinical stage. Please take it to your heart. Don't take or don't think that your heart will give any symptom when it becomes disease. No. Almost 80% of the patients don't have any symptom in the initial stage. That is the first message that you must keep in your mind. Don't ever think about that one, that I am not having any problem, so my heart is okay. No. Initially process will start without any symptom. So initially you won't have any symptom. Second, we can have a symptom I mentioned, but angina. Angina means just chest pain, especially after exertion. Someone is doing normal activities, there is no pain. But suppose he or she wants to climb up, walking that one, after certain stage finds that no, I cannot do, I have got some pressure in my chest, I have to stop. That will call them the angina. So second you can have an angina, and then you can have a heart attack. So these are the three things we usually happen. Initially starts no symptom, then angina, and then the heart attack. Some patients can go to heart attack and go to the heart failure. Because heart attack means muscle is damaged, so pump is damaged, the pump won't be able to pump properly, heart cannot be able to pump properly, get in heart failure. So these are usual course, natural course, your clinical course. Some patient can have from the no symptom stage to the heart attack. As I mentioned, they don't have any symptom. People say, okay, yesterday this patient is suffering. My someone I know, he was having completely normal yesterday. How did he get the heart attack today? People think that it can happen because he don't have a symptom. From the no symptom, the heart attack. Some can have it from the angina, you can have directly the heart failure, no heart attack. Some from the no symptom can be heart failure. So you can see the various combinations. You cannot pinpoint they should go to the same course. There's so many sidelines it can go through. So no symptom, angina, heart attack, heart failure, these are all a complicated course that we can go through, and all of them have got the problems of sudden death. Even if someone not having a symptom, he can have a sudden death. He can have an angina stage sudden death, heart attack sudden death, heart failure sudden death. So these are the course. So three messages I want to convey to you. First is, and you just keep it, you can write it down, and best thing will be write it mentally in your mind, in your thoughts. The seed of heart disease is sown in childhood. I given you that picture, that one. That even in 10 years of life, it starts. So seed of heart disease is sown in childhood, and that's the reason why we have come to you, that you must understand what you should do to prevent that process. Second, the size of the plaque does not matter. People say, I got 80% block, 90% block, and people get worried. No, you get worried because of the type of the block. Even if 40% block, even if just block is forming, you can have a heart attack, and most of the time you get a heart attack because of the 40%, 50% block, because at that time the plaque which is forming is very soft. It can burst, and when it bursts, it makes a clot. 80%, 90% block does not give rise to sudden heart attack, because if you have gone to the extent of 90% block in an artery and not having any symptom, that means the side branches are giving a supply. So be worried about the type of the plaque. It is stable plaque or unstable plaque. I have to explain because time is not there. But remember, the soft plaque, the plaque which is forming, is very unstable. It can burst. It's something like if I can put it that one, you get a pimple. You get a pimple in your face. Initial stage, it will be soft. You just put it that way, it will be soft, and it can burst. But after a certain period of time, it becomes very hard. It does not burst. It remains like there is a hard lump. It does not burst. Same thing also, a pimple in the arterial wall, initial stage, soft, it can burst and make a clot, but later on, it just obstructs the flow of the blood. But does not, it can give rise to angina, but does not give rise to heart attack. So anyway, size of plaque is matters and type matters more. And you can see, make the unstable plaque stable by our medicine or other measures. And third is, don't wait for the symptom to start heart care. Don't ever think that once I get a problem, then I'll take care of my heart. Because it may be, as I mentioned always, it is too little, too late. Why plaque forms? Why it is me? People ask me that I have understood that plaque is forming, but why should it affect me? Why it is forming? And there come the concept of risk factors. Like when you have a risk factor, you start acquiring risk factors, so you get a problem. So risk factors of coronary artery disease are, some risk factors are non-modifiable, some are modifiable. Non-modifiable can't do anything about it, you have to live with those non-modifiable factors, but modifiable factors you can always control. And these non-modifiable factors and non-modifiable factors you can put in three groups. One group is called the personal group, personal profile. Everyone's profile is different. Is it not? Everyone's profile is different. Your born family is different, your heritage is different, your attitude is different, your gender is different, everything is different, age is different. So these are called the personal factors. The second comes is the some diseases. Heart disease does not come suddenly like that. Usually it gets some other diseases previous to that one. And lastly is the lifestyle. So these are three groups of risk factors, and out of them some are non-modifiable and most of them are modifiable. So what are the non-modifiable personal factors? Age, sex, heredity and personality. Age you can do. Age is a factor because over the period of time, wear and tear, the blood vessel will get damaged, lining will get damaged, there will be formation of this plaque. It will go on. Elderly people have more risk than the younger people. So age is a factor. Sex, male sex has got more risk than the female sex, especially before menopause. The females are protected by their female hormones, but after menopause, the risk becomes more or less same. Third is your heredity, family history. Some heart diseases runs in the family, and you cannot do anything because you cannot choose your parent. So forget about that one. You change your heredity, but please remember, even if your family history is bad, if you've got a family history that has problems with the heart disease or hypertension, diabetes, it doesn't mean that you will have that same problem, because you can modify your destiny, modify your genes by taking precautions. So genes are not our destiny. Please keep it in mind. Don't ever put blames on the heredity. That my father has got a problem, so I will have the same problem. Don't take it that way. You can control. Only thing, if you got a bad family history, it makes it more imperative for you to take care. And personality, some personalities will be there anyway. So these are the non-modifiable. But what are the modifiable factors? There are 4 diseases which give rise to the coronary artery disease, and these are the 4. We call them the gang of 4. Hypertension, high blood pressure, diabetes, cholesterol abnormality, and then obesity, weight. These are 4 things. Now, all these 4 diseases are very easy to make a diagnosis, easy to take care, easy to control, easy to treat. Only when not we were conscious about it. How many of you have checked your blood pressure? Tell me. How many of you present here today have checked your blood pressure once in your life? This was boys are having a blood pressure 170 by 90. No other symptom, only something like that. No, that's why I'm telling you that please go there. Diabetes, you don't get any symptoms. Cholesterol, obesity you can always check it up. Wait, you check it up. Anyway, so these are called the modifiable. You can make a diagnosis, make a treatment, treat the disease you got that one. And then this is called the gang of 4. Everyone will get the gang of 4. And then third is your modifiable other lifestyle. Lifestyle is the bad food, physical inactivity, smoking and the stress. Smoking and tobacco both they combine together, and the stress. These are called the band of 4. So gang of 4 and band of 4. We have to take care of the gang of 4 and we have to take precautions about the band of 4. These are the, basically this is what the article is all about. The gang of 4 I mentioned, blood pressure, cholesterol. See how simple it is. Just get a prick and know your blood sugar. Cholesterol, okay, it's difficult. You don't have to go for cholesterol test all the time, but once in 2 years, 3 years, you can get cholesterol. Some people have got a cholesterol runs in the high cholesterol running in the family. This is called familial hypercholesterolemia, and then the obesity. And for this one, obesity, you don't have to do anything. It's obvious. So these are called the, and many a times, all these 4 things, they come together. What is this? Just because I am talking all the time, your mind must be dozing. What is this? Any guess? Anyone? Related to medical science. Come on, anyone? Okay. No guess. No guess. There's no negative markings here. There's no negative markings. Guess it. Anyone? No. What is this one? The monster looking face. Okay. Next one. Another clue. The same one. Another clue. Drosophila melanogaster. Now why I have brought this big name and showing you this picture over here? The picture where I put in that one because this is a very important medical science. Do you know that medical studies, researchers on this fruit fly have given us to 6 Nobel Prizes in medicine. 6 Nobel Prize in the medicine has been because of the works done on the fruit fly. Because fruit fly is very easy to eat, it matures in such a quick period of time. The genes are very much related to the human genes and the studies can be done. And in 2017, the Nobel Prize was given to Michael Young, Michael Rosbash and Jeffrey Hall for finding out the molecular mechanism of biological clock. We have not heard of biological clock. Do you know what is biological clock? Anyone? Anyone? We must have heard biological clock. Yeah, circadian. Who is answering? Will answer this one? Yeah. Okay. You see, everything in our body system goes to a certain rhythms, patterns. We feel sleepy at night. Why? Our hormones levels, surge of hormones, the hormones, it goes by this day and night cycle. This is called the biological clock. And the molecular mechanism of biological clock is identified by these scientists by working on the fruit fly, the Drosophila melanogaster. So I think this is something I have told you. Now, what the time left for me? How many minutes I can spend? Say, I'll give a tip. In English, when you find a quotation and you look under, find out, guess the names, blindly put the name of Shakespeare. You'll be correct in 90% of the times. Any quotation you see in English literature, and you don't know whose quotation is this one, and if you see the quotation is something and it looks like ancient, then you can always put it, must be Shakespeare. So this is a quotation of the Shakespeare. The way to a man's heart is twist over, but now when you put this quotation, you never thought it will be so prophetic, because the way to a man's heart disease is also twist over. When you get the heart problem, it goes to the stomach first. It starts in the stomach. It starts with the mouth. So this is the way to a man's heart disease. And why should it be about the men's only? I think I cannot be accused of gender bias. So I put it even over the woman's heart also. The way to a woman's heart disease is also through her stomach. And here, the both quantity and quality is important. It's not only the how much you take, but what you take. The quality is also important. What you take is as important as what we don't take. It's not only how much we are taking, what we are taking, what we are not taking, that is also important. So the bad food recipe, or the recipe for a bad food for the heart. First take your food, the calorie is very high. But you don't need it, you take it, and it goes deposited. It just don't go out. Whatever is wasted, but whatever the things are required, what the nutritious things, body will absorb. And what you will do, body will got the habit, you will put it in the pockets as a fat. So you take high calorie, energy more you take, it will get deposited as a fat. So you have to control your calorie, that is one thing. The second comes the very sweet. Our bad food recipe is sweetie. The sweet, the sugar coated. We say sugar coated pill. But you without doing the sugar coating of the pills also, you can have the problem, the sweetie food. Third is fatty. Sweetie, fatty, and then salty. Now, these are the adjective that you use for our bad food, and it is the cholesterol rich, the high cholesterol. But please keep it in your mind. The cholesterol in the food does not cause much increase the cholesterol. It is the saturated fat which is important. Don't think of zero cholesterol diet, zero cholesterol. Cholesterol you can take. You can take one egg, because one egg contains only 300 milligram cholesterol, and in a 60 kg body weight person, the 300 milligram is not going to do anything. But you take saturated fat, the liver will produce cholesterol, and that is most important. So this high calorie, sweety, fatty, salty, cholesterol rich diet is the bad food recipe for the heart. Now in your school days, you must have gone to exercise, especially in literature. They give you 4 or 5 words and tell you express in one word. Is it not? In one word you express it. You must have gone that one, in one word in that class. So if I put it high calorie, sweety, fatty, salty, cholesterol diet, you put in one word. What will be the word? Any? You don't have to, it is a guesswork only. You can make your own word. You can liberty. How you can express it in one word? What? Junk food is okay, junk food, but sometimes junk food cannot be salty, cannot be thick. Yeah, junk food is one word. But high calorie, okay, I take it, it's one type of word. I will put it, and I will obviously agree with me, especially your tiffin time when you do it, these are very tasty. So all the tasty foods that will like it, yummy foods, delicious foods, these are sweety, salty, fatty, high calorie. I personally picture the Bhattacharjee and this thing, that thing. So most of the time you see that. So they are very tasty food. Yes, that's why we go for that one. Why all of you young people are going after that? Because these are very tasty, delicious. But anyway, when I say to you that you don't go for this one, I'm not telling you to deprive yourself of everything. You take it, but take it in moderation. Don't take it in excess. And you must take Saravati things also. I'll show you later. So these are the things we call it sweety, salty. Excess of salt is bad. Excess of fat is bad. Excess of sweet is bad. In fact, sweet is more dangerous than the fat, as I mentioned. And if the food is lacking in fibers and roughage, is short of antioxidants, and as she mentioned, but junk foods, this falls into that category. There is no fiber, no roughage, no antioxidant, only calorie. These are called we call them the empty calorie. So beware of the high glycemic food, high fat cholesterol, lipid food. So first priority will be for you to go for a heart smart diet. Heart smart diet, we will understand what is heart smart diet, control the calories, saturated fat, everything will come down. These are the things, you know it very well. But remember that this plate is the American Heart Association is giving that one. Most of the time what happens, our plate is filled up with rice, and then we have that one, no fruit, no vegetables, and mostly you get the protein and the meat or something like that. So you must have, my plate should be, fruits and vegetables should make up half of the plate. And the other half will be grains and then the protein. Protein you can take vegetarian protein, non-vegetarian protein, and then dairy products. So these are the combination that you should have it. Especially young people, you don't have to restrict anything, but make it that at least half of your food is made up with their fruits and vegetables, natural sources. This is the color code. You must have a color code in your diet. Color code means you must have all the colors in your food. And that is only available in the vegetable kingdom. In vegetable kingdom you get the colors. Green, yellow, red, purple, magenta, black. You go to the market, you go to the vegetable market, you see there are so many colors. And all colored vegetables are good for the heart. So you must have the colored vegetables, colored foods, a mix of the foods. Don't go for only a single type of food. You must have a mix of the foods. The food pyramid, it is only showing that one what you should have. In the bottom you should have the cereals, this is the basic food, and the top you should have less of sweets, fats and oils. Second come the part is activity. The three types of activities are that physical activity is what about the heart care. just skip something. So activity is very important because coronary disease is a foot and mouth disease. Have you heard about the foot and mouth disease? Have you heard? You have not heard. Okay, did not hear, but earlier it came out in the papers. It is a disease of the mostly the bovine population. It is a virus disease where you get the bovine population, the cows and others, they get the ulcers in the mouth and the feet. So it is called the foot and mouth disease. But I put it here, coronary disease is a foot and mouth disease. Why are you putting it here? Is it because of that infection, virus infection? No. It is because the coronary disease happens because it is a disease of the busy mouth and lazy feet. So this is the definition of a foot-mouth disease. The coronary disease is busy mouth. Mouth is always busy and feet is lazy. Just see, imagine, this other one is lying down taking so much of food and the man is relaxing. The feet is so lazy, you don't have the time to move about. So you don't want to go for the stage, make it the other way around. You make it lazy mouth, busy feet. Okay? So do exercise regularly. If you want to have exercise, you can go. But best form exercise, especially for the for us, the senior citizens, you can say it is working in the best form exercise. And for you, I can recommend something which you like, which will be useful for your physically, emotionally, romantically. You look at the emotional heart and also physical heart. Can you give me an example? What is the best exercise for you? Come on. Come on, tell me. Yes, something in your mind. Huh? Pardon? Laughing is for you. Now just imagine yourself going out the bank balance. What is inventory? What assets you have got? The same thing, you must make your own asset liability. This stock situation, stock taking will be there. Lifestyle modification is lifestyle enrichment. And it is not only preventing coronary disease, it is preventing hypertension, diabetes, stroke, even cancer also. Action starts with you. It is not someone else will do it for you, it is for you. Most important step, you must know yourself, know your figure and know your number. These are the two things I mentioned. You must know your figure, know your number. We always become very figure conscious. No, so this must know your figure. What the figure means, your weight and shape and size. Your shape and size is important. There are two types of obesity. One is called the apple type, one is the beard type. And I mentioned abdominal obesity is bad, it is high risk. So you must get your height and hip size, waist and waist size, and you can find out divide types of obesity, parameters are there. And know your number means you know your metabolic profile. What is your blood pressure, what is your blood sugar, what is your cholesterol level. Life is full of choice. Everyone is making a choice. Everyone is going for the choice. And the problem is we have so many choices and also opportunities. So choices are there, opportunities are there. You have to make your own choice. Now you see, this man is making his choice. You don't have to tell anything. He has got his partner, the tallest man with the smallest girl. He has made his partner. Or the other one, the thinnest man with this petty lady. So they made their choices. You don't have to tell it. The choice is yours. The same thing also, you have to make your own choice. If other choice you do good or make, it is up to you. We cannot tell you that. We can give you the alternatives. You make your own choice. So you have choices. Whether you want to be like that when you grow old, like us, or want to be like that, it is your own choice. The same thing also for the girls, you have to be like that or this way, it is up to you. You make your own choice. You don't have to tell anything about that one. Choice is yours and yours only. Now, these are the stages in the life. In the life stages, you go through the stage. Everyone is going through the stage. From the toddler, infancy, children, adult, then this old age. Everyone is going through the stages of the life. Can you find the difference between the two? Can you find the difference between the two pictures? One is the male, one is the female. Man and the woman. Any difference? Huh? Yes, in the ladies the stages are more because the reason that because the menopause part of it.
So pre-menopause, post-menopause, these are given later on. Because it's important for the heart care also. When you talk something about the woman's heart disease, we can talk about that part. Anyway, so these are the different stages in the life. But in every stage you've got to take care of your heart. Heart care, it means at every stage, even toddler, children, I mentioned, you need to have a heart care. Who says you don't exercise? Every one of us is exercising. We jump. See the children, adult, we always jump, we throw, we twist, we stress, we bend, we push, we lift, we run. Everyone does it, especially in their young age. Every one of us has done it. But what happens when you grow old? The same exercise you are doing, but the other way. What happens? So we are absolutely fit. You think that we are absolutely fit because we are doing jumping, throwing, twisting, stretching, bending, pushing, lifting and running. All things are our activities in children. But what happens? We jump to conclusion. We throw our weight around. We twist the truth. We stress the lies. We bend the rules. We push our lie. We lift our egos and we run from pillar to post. So these are when we grow old. These are activities. The same thing. Jumping, throwing, twisting, stressing, bending, but the purpose is different. And that's the reason why happening, it does not make us fit. Because we are fat, because we eat our words so often. We also eat. Our words we are eating. We are taking that one. We are eating everything, including our words. Obesity is not because it runs in the families. Don't give me that idea that in my family everyone is obese. It runs in the families. Don't give me that idea. Obesity is not because it runs in the families. Then why? Why there is obesity in the family? Because obesity is because no one in the family runs. That is the reason why obesity is there in the families. You always say that you only live once. They are always saying that you only live once. Always say, you only, yaar, you to बचना तो एक ही दफा बचना है. You only live once. No, it is wrong. You live every day, and you only die once. Keep it in mind. You must live every day. Don't think of that one time you will be one life. Your life is every day, every moment you have to live. And you die once is okay. This is our society, and we welcome everyone to be part of the society, become a member of the Heart Care Society of Assam. Have love for the heart and a heart for life. We always say, you must have a love for your heart. Unless you love your heart, you cannot have a heart for life. And have love for your heart, and can you just tell me, I love my heart, let it beat. Just tell me. All of you tell. Yeah, I love my heart, let it beat. Everyone should but not only your heart, I know you will be loving others' heart also. I will tell you that you will looking after other hearts also as good as looking after own heart. But think about the heart. Keep the heart beating. It's a very, very good organ, beautiful organ, vital organ, faithful organ. It does not get sick. Everything will stop, it will go on beating.